Okay, so for those of you who were here, there's a much smaller number of people online than were here on Wednesday. So for those of you who were here on Wednesday, I'm not going to go through the first few slides that I did last time. And for those of you who weren't here on Wednesday for that talk, these slides I'm sure will be available and you can have a look at the process that we used. And I'm just going to run through the slides. Uh-oh, they're not moving. Wait a second. I know why. There we go. So I just described what the national statement sort of is in very broad terms, what our history of updates is starting from 1966 through to now. The current focus on the current review of Section 5. As you know, we took on two sections, Sections 4 and 5 this time. Section 3, which we did ending in 2018, published in 2018, took a couple of years, and we took on the other two sections because we felt that they were integrated and needed to be done together. The wisdom of that decision is questionable, but it's too late now. So that's how we're doing it. The stages in the review process. We do have a pattern for how we do these things. Separate committees to develop material, and then consultation, and then review of the consultation. There were 117 submissions received as part of this consultation, most of which addressed both sections 4 and 5. Then we analyzed each submission, and then, of course, because we were changing, as you'll see in the content of the slides, because we were changing Section 5, we also needed to change Chapter 2.1 on risk and benefit. The schedule for how we're going to do this, I'll get to at the end. Where we're going to go from here. So, for those of you who are familiar with the national statement, which you all hopefully would be, Section 5 is a little bit different. It doesn't address so much the content of research and how to approach it and ethical principles. It addressed processes, including institutional processes for levels of review, HREC composition and operations, monitoring obligations of institutions, review bodies, and researchers, conflicts of interest, complaints, and accountability. So a bit of a grab bag, all in one section. We did contemplate sort of blowing that up and trying to do it differently, but decided that it was satisfactory the way it was, and our input back to us had never been, the section doesn't work, you really need to change it. So we're sticking with the structure of the section more or less. The public consultation draft that we put out, that was the consultation period of last year from August to October, included the changes to Section 5 in principally 4 areas. We contemplated a reduction in levels of risk from 3 to 2, and relabeled the 2. We expanded eligibility criteria for exemption from ethics review, which a lot of people wanted done, and which we supported strongly. Proposed criteria for acceptance of overseas review, and made changes to the requirements for some of the HREC membership categories. So to show you the difference between what we did for the consultation draft and what we have now done since, as a response to the input from the consultation, is up here, and I'll take a little bit of time on this one. So we originally thought, okay, low risk review and negligible risk review, they are 2 separate pathways in theory because they're 2 separate risk levels. However, our experience was that we knew of no one who actually had separate processes for review of low risk research and negligible risk research, even though they might have acknowledged that there was a difference between the 2 and might even have labeled them. The way they approached it wasn't really any different. On top of that, there was a concern that the difference between discomfort and inconvenience was ambiguous and difficult to rely on in a stable way. And so we thought maybe we would reduce the problem by simply getting rid of the negligible risk category. And also might want to note here that there's a good argument that inconvenience is not itself a risk. It's something that is, along with risk, something that one should be concerned with, but not a risk in and of itself. So we decided to go back to the ideas of greater than low risk and low risk, but simply eliminate the negligible risk category. And so we've gone from an attempt at moderate to high and minimal back to greater than low and low. And one of the reasons we did that was people asked quite sensibly, well, what if something isn't minimal, but it's not really moderate? It's what we would call in the old days low. So that would have required a three-category system again, and simply relabeling them. So we thought that really the distinction that mattered was greater than low and low. And we thought the other thing that we needed to add was some more language, some more guidance around the need for both risk assessment and review pathways, and that these are two separate processes, and it may involve different people doing them. So that, for example, you might have a risk assessment done by one person or set of people within an institution, and then the actual review of a low risk research project would be done by a separate group, or you could combine the two processes. Exemption from review, and I'll go into exactly what we've done with that in a couple of slides. It was widely felt that we needed to expand those criteria. Someone yesterday put up a slide. I think it might have been Adrian Barnett, put up a slide that noted that of all of the nations in the world that they'd surveyed, that the most generous, let's say, country in terms of exemptions was the Netherlands, and the least was Australia. We were at the absolute most narrow definition of what could be considered exempt. So we have expanded them, but we had done it in a way that didn't work, and so we've rejigged it, and I'll show you what we did. We also proposed criteria for the option, not the requirement or a program or even an expectation, but an option for acceptance of overseas review, based on the notion that researchers often will come to us and ask for advice on how to get research that's been reviewed by ethics committees overseas, reviewed in Australia, and we need to respond to them that they need to get their research reviewed in Australia, no matter what they've done overseas. And this seems to be an inefficient way to approach matters. So we wanted to try and enable that opportunity, and institutions could do that if they so wished. But we based this on what we call the standard equivalent to the national statement. Well, that became problematic because it naturally begged the question, who assesses whether it's equivalent to the national statement, and what are the criteria for equivalence in any case? So we rejigged that a little bit, and I'll show you. I won't show you actually how we did that, but basically what we've done is to say that if there is this option, it's discretionary, it's part of an institution's approach to external review more generally, and that any decision to accept such a review would be based on evidence submitted by the researcher that is persuasive to the institution that it merits that acceptance of that review could be provided. But what we want to do is make sure that people don't say the national statement prohibits it, either because it explicitly prohibits it or because it doesn't say anything, which some people consider to be prohibitive. Finally, some HREC membership issues. Most of it is still the way it is, but we wanted to clarify the concept of membership pools, which a lot of people are now relying on, and most obviously Bellberry, but many others. And in so doing, we have changed some of the language related to categories B and D of the minimum membership, laypersons and pastoral care, and you'll see what those are. We also added a little bit more language or different language on required diversity and expertise. And this, of course, because of the first issue, risk levels, has required revisions to chapter 2.1. So just to give you an example of how we've done the risk levels and corresponding review pathways, So this is the actual language that we're proposing. I won't read it to you. And these slides will presumably be available, and you will see these as part of the next public consultation. But this is how we're approaching that particular issue. It's not that different than the way it was, other than the explicit reference to risk assessment as separate from review, and the reduction of greater than low, low, and negligible to simply greater than low and low. With respect to the exemptions, I'm sorry this is all very small font, but to get it on one slide, that's how it came out. So what you'll see here is we've said that research is eligible for exemption of a grant of exemption from an institution. That doesn't mean that it is definitionally exempt. It is still, as it always has been, a decision made by the institution whether to grant exemption, which means that you have to ask, if you're a researcher, can this be exempt? Now, an institution, of course, is entitled to develop a policy with various a tick list or criteria and some presented in some other fashion that would enable researchers to make that judgment provisionally in any case. And how institutions will manage that is going to be up to them. But we can't set it up as if it can be definitively exempt without reference to consultation with an institution on some level. That would mean that research could be done without anybody knowing that it was being done, and that's problematic. So research, we also then needed to make it explicit what isn't eligible, and research that involves the use of personal information without consent cannot be granted an exemption from ethics review, because to conduct such research, a waiver of the requirement for consent would need to be granted by an appropriate ethics review body. And so that's the limitation. We then set out essentially 4 options. First, it has to be a low risk review project, where it originally settled negligible risk, now it will say low risk. And then the 4 options are having to do with collections of information or data, surveys, observation of public behavior, type research, research that's conducted as part of an educational training program, and research that uses only information that is publicly available in a particular way. And that's the proposal. You will have an opportunity to comment on that as part of the upcoming consultation. Now, when will that consultation be? We've unfortunately been a little bit hamstrung in our process because of the tenure of the Australian Health Ethics Committee is a 3-year tenure, and that committee finished up in June of this year. However, until just recently, we have not had the official appointments to that committee, and therefore we've been unable to schedule a meeting of that committee in the second half of 2021. So that the work that we've done on this, which has been ready for some time, won't be looked at until February of next year. After that, we will then clean up anything that we need to clean up or change, and we will put it out for public consultation. What we're going to do then is put out Chapter 2.1, which no one has seen the changes to. And as background information for that, essentially, you will get the new version of Section 5, which of course you will be able to comment on in any case. We think it all works quite well. We're really eager to see what you all